Good afternoon, and welcome to today's webinar on Starting the Cost of Care Conversation, Implementation Strategies, Resources, and Available Tools. My name is Karen Lovello. I'm Director of Education for the New York Chapter ACP, and our facilitator today is Amanda Allen. She is the project coordinator here for the New York Chapter ACP. Before we begin, I'd like to review a couple guidelines. All participants will be on mute since we have such a large audience. If you have any questions, please type it in the dialog box on the right, and Amanda will answer all your questions at the end as they come in. If we run over the allotted time, we will send the answer to your questions through email. Following the webinar, you'll receive an email with a PowerPoint presentation and a short survey. We ask that you complete the survey. It's only 3 questions. We will have the recorded version of today's webinar posted shortly on the practice management page of the chapter's website at www.nyacp.org. I would now like to introduce Amanda Allen.
Thanks, Karen. Hi, everyone. I'm so happy to join me for our first webinar in the Cost of Care Conversation series. I'm actually the project coordinator here at NYACP for this Cost of Care Conversation project for empowering physicians, helping physicians to empower their patients. And I'll be providing the education, outreach, and information for our members, as well as doing research on tools and gathering information to create resources for you. So prior to this role, just a little bit of information about me. I spent 13 years in both the medical and behavioral health field in offices leading EHR and practice management system implementations, providing guidance for revenue cycle management, and also helping with transformation assistance on a bunch of different initiatives like PCMH and meaningful use, MACRA, those sort of things. So I'm really excited to be involved again in offices with this project and get you guys started on the cost of care conversation. So today, my goal is to ensure that everyone understands what the Helping Physicians to Empower Patients initiative is, understand the whys, the hows, the whats of it all. So we need to know why we should be having the conversation and what the benefits are to everyone, for both you and your patients, to having the conversation. So once we have that background and overview, I'll also be providing you with some tips, tools, and resources to help you get started. I want you to know how you can start it in your practice and spark some ideas and give you materials that you can either take and use today or adapt to your practice. So our agenda, we're going to do a brief overview of the initiative, talk about the benefits to everyone involved, then get into the nitty-gritty of kickstarting the conversation in your practice and the steps and the tools to go along with it. And then I know everybody wants to know about those elusive cost and quality transparency tools. Well, they're not going to be elusive anymore. I'm going to give you that list. You'll have links to those to take away and look at as well. So we'll cover those. And then, like I said, this is going to be a series for webinars. So we'll introduce you to the next webinar so you can plan accordingly, see if you need to come to that and want to come to that. We'd love to have you. And definitely make sure that survey that Karen mentioned that we're going to share at the end, please fill it out. It informs future newsletter articles and webinars. So your feedback is so important and so valuable to all of us. And then finally, we'll open up questions via chat at the end. So make sure you're jotting down anything that comes up along the way. So let's talk about who is involved in this initiative for helping physicians to empower patients and how NYACP is involved. So it's a grant-funded project, and it's funded by the New York State Health Foundation, and they recognize the need to increase the use of and awareness of the available cost and quality transparency tools. And then they also know that in order to increase awareness and increase use, got to encourage the conversations at the point of care between physicians and their patients. So they awarded NYACP at part of this grant, and we're also working on increasing the awareness and use of the tools and taking it a little further and giving you the skills and the tools to enable you to implement and have constructive quality and cost conversations. Plus, part of this is also working with about a dozen or so offices as ambassadors with our early adopter incentive program, where I'll be working on one-on-one transformation assistance with them, and we'll be gathering information and ideas and data to help inform the tools, resources, and education we'll be sharing with the entire membership. Basically, at the end of the day, it all comes down to two things. We want to start the quality and cost conversation, and we want to share the tools. It's really as simple as that. So we need to know, in order to do that, why it's important to do that. And really, it's out-of-pocket costs for patients are higher than ever and seem to be climbing every year. We all know that high-deductible health plans are becoming the norm now. So financial harm is actually becoming somewhat like a side effect to consider, and even something that is starting to fit into risks and benefit conversations when you're talking about treatment plans with patients. So we want to reduce financial harm. Almost half of Americans can't cover an unexpected $400 expense, and we know how easy that is when we're talking about ordering imaging tests and things like labs that will go towards your deductible. Another thing to consider with reducing financial harm is it's not always who we think it is that's going to be affected. These Americans who can't cover that cost include insured patients and include patients with incomes over $40,000. So it's not always the uninsured and low income that are affected. And then by reducing that financial harm and giving them options and talking about this, we can help improve adherence. So last year, a quarter of patients actually chose to forgo cost or chose to forgo care due to cost. So we want to make sure that they get the right care at the right place at the right time as well. And then studies have shown and surveys have shown that they want to talk to you. Actually, a survey was done of New York patients, and 2/3 of them think it's a good idea to talk with their doctors and the doctor's staff about it. Oftentimes, they just don't know how to do it. And so having that conversation can really increase the trust that they already have in you. It can help reduce their stress because you're helping them navigate a confusing system as well. And then having the conversation also provides information. So a majority of these patients don't know where to find the information or say there's not enough. Same thing goes for clinicians, physicians out there. You're wondering where to find it. Those tools are out there. They just aren't being utilized. People don't know how to go about it or where to go to find them. So we want to be able to provide information through these conversations. So we talked about how the conversation can help the patient, and I also want to talk about how it can help you and your staff and your practice. First of all, it's not only going to empower the patients with knowledge, it's going to empower you. You'll have usable cost and quality information that you can take away, that you can provide in your conversations that can inform conversations with patients and help with informed decision making. It's not about knowing every answer and every cost amount. It's really being able to provide guidance for the patients. You'll be able to send them in a direction or give them the information they need. And that all helps eliminate the awkwardness. You'll welcome the conversation. You know they want it. You guys will be able to speak together without the awkwardness surrounding that topic. And then there's also related rewards for you. Patient satisfaction, a really, really easy one. Your patients will understand and know that you're really treating the whole person, and that really improves your relationship with them, not just about the survey answers, but your intrinsic relationship with them. It'll also help you for value-based payment models. You can use it to look up utilization information, or information for utilization, I should say, the prices that, surrounding facilities and specialists are charging for, or that people are paying for, depending on the dollar amount that you're looking at, for certain treatments or certain procedures. So it'll help there. And then there's actually some items, some organizations out there that have modules that you can go through about the cost of care conversation or related skills such as shared decision making, and you can actually get CME credits for those, so that's always helpful and always good to have as well. And then don't forget that this is something that we don't want to make a big burden or a huge side workflow for this conversation. You really want to look at the synergy of the system. What do you have now? It's not meant to be a big burden on one person. All the staff in the office can have a small role that's going to make a big impact. Every patient touch point can have just something small that encourages the conversation or reinforces it or screens for it or shares information. So it can be spread across the practice. And there are little workflow additions as well. And then we have other initiatives out there like MIPS improvement activities, CPC Plus, TCPI, so many acronyms. But we have those out there that actually are supported by this conversation, things that you can integrate in your care plans and your workflow. And New York State PCMH actually has a measure that is about having the cost of care conversations with your patients, as well as looking up quality information about providers or physicians that you're referring to. So those New York State PCMH measures actually directly relate. So it's really helpful to overlap in this case. So we want to make sure that with all of this, you guys experience the benefits and we help you do that. We're going to provide you education through the webinar series, as I talked about earlier, as well as newsletter articles. I'm going to say it again, definitely give your feedback. We want to know what you need, what you want. So we want to help you with that. We'll also have resources. You will see them throughout this presentation, and we also have links to them on our webpage, so I'll provide that at the end. You'll get the links in the slides, and you can always access our webpage. But we have a conversation toolkit that provides strategies and materials and templates that you can either use or change a little bit to adapt to what your practice needs. We also have that list of online tools. We've gone through and vetted them. We've looked at criteria based on what we know our members want and need, as well as some information from an ACP white paper on the topic. So we looked at those and compared them to another study on online tools as well. So we vetted them and put the ones out there that we felt would work best. And then we also have contact with the tool vendors, and they're really open to feedback. So again, the feedback that you give us really helps. It's a really awesome experience to have. So we can hopefully influence change there for what our patients and physicians need in those tools. And then we'll also provide you strategies from previous grant studies, as well as from our early adopter incentive program. We'll be gathering that information and sharing it with you as well. So now that we all understand the who's and the why's of the initiative, let's talk about the how's. And we want to give you a starting point to get this implemented in your practice. So there are 4 steps that we're going to cover today, and they all came from compiling information from organizations and individuals that have worked on studies, other grants that involve cost of care conversations. Those organizations and individuals you'll see up in the little cloud up in the upper right-hand side if you want to refer to them. But when it comes down to starting this in your practice, there are really 4 steps. Engaging, not only in your practice, but with your stakeholders. So assess the needs of your practice, understand those needs, choose the best tools, resources, and materials for you, and then spread the word to others in your practice. Get them to believe in it in order to facilitate the change. Then once you've got that core belief and that foundation set, go ahead and train them, educate them. Training is so important and it definitely needs to happen. And then once they're trained, put it into practice. Incorporate the tools and resources in your workflow. Start encouraging patients to ask. Get comfortable with that. And then as you implement that more into your workflow, you'll be empowering the patients and you can actually start reaching out more. You'll be sharing the tools and providing your patients with new information. These steps may seem like a lot, but I have slides for each of these steps that'll give you strategies and resources. and it'll help you understand what you need. So you know your practice. You're going to see what steps you've already got down, what steps you feel comfortable with, and what steps you need to focus on. So we'll start with, of course, engaging your practice and the stakeholders in your practice, so the administration and the staff and other clinicians. And really, the first thing you want to do is identify the need. So, look at services that you commonly order or that are included in your treatment plans. Take a look at the price ranges in the area. See what is, what ones are the most expensive, just so you can be informed about it. Things that you'll need to bring up in conversation with patients. Also, look at the tools and resources. Take a look and see which online tools or which materials will best support your practice, and which ones you want to use. There's a lot of different information in the tools, and you're going to know what your practice and what your patient population needs. And also look at the readiness of your practice. So, have you done a recent initiative change? Are there new changes to your workflow? Have you implemented an EHR recently, or changed to a new EHR? Anything like that, a big change could risk burnout when you add something else in. So it may be something that you let things settle, let people settle into a routine, prepare for it, and then actually go and engage the stakeholders a little ways down the road. So definitely just consider that and take a look at it. And then also start looking for a champion. Not everybody is comfortable having this conversation. So you want to look for somebody who believes in it and feels comfortable initiating it. Certainly not going to be perfect the first time around. So you want somebody who's confident and can lead by example. You'll notice at the bottom of the identified need column, I've got two boxes in green, and you'll see them throughout these slides. These are going to be resources that are related to the topics that I talk about on these slides. So there are links here, there are links at the end, and they're on our website as well. But two things that will help you with identifying needs. We have the self-assessment questionnaire that NYACP has put together, has some items on there that will just go over what you're doing in your practice now that actually sets the foundation for the conversation. You'll be surprised that you're doing more than you think already. And then also there is the online tool quick reference guide that just puts a list of the tools together and shows the cost information, the quality information, and what it's best for, what each tool is best used for. That way it'll help you narrow down the tools that will work the best for you and give you a good starting place. So another thing to consider and identify, not only your needs, but what things you have in place already that you can use, what you can leverage. Look at your current workflow. Are you having a conversation already? Are there places where you can spread it out into different touch points, at check-in, at checkout, in order to facilitate the conversation or welcome it a bit more? Look at your current technology. What can you change in your EHR? Do you have decision support that can help you put information in at the point of care so you have information to inform your conversation then and there? Are there links? These are web-based tools. There's no interfaces, so could you put a hyperlink in if you want to be able to refer to those tools? And also consider messaging in your patient portal and your website and what you're allowed to change there, or what you're able to change there. And then also, we talked about it already, but definitely look at related initiatives. I'll go ahead and open up the self-assessment questionnaire and show you just a little bit about it. But if we scroll down to the second page, you'll see that the measures that relate to all of those different improvement activities in MIPS or PCMH, all those measures are there, so you can see which ones they are and check them off. That way you know, hey, we've already got the foundation to do some of this stuff. So definitely check out the self-assessment questionnaire when you're looking at what your practice needs. So then once you've got your practice assessment done, and you're really engaged with what your practice needs, it's time to engage the stakeholders. The first thing is get them to recognize the reason. It sounds so simple, but they really do need to believe in the importance. Use our slides, use the data earlier on in the slides. We also have an infographic that's a simple one-pager that you can hand out as well. So definitely get them to empathize and believe in why the change is needed. And then the next step is getting them to understand the goal. So understand the goal of the entire practice. What do we want to get out of this initiative for us and our patients? And then what's the goal of each individual or a goal of their role? So they need to understand, and they want to understand, how it's going to affect them, what does it mean for them, what are they supposed to do? And they're probably going to want to know that all up front, but of course, we will get the training for that. They at least need to see, where they fit in the puzzle. How are other roles supporting them, and how are they supporting other roles, and then how are they supporting the whole goal of the conversation in the office. So we do have a sample workflow for that, and you can take a look at it to, inform them. You can adapt it as you need, but it's got different touch points, the typical touch points within a practice, and then ideas for workflow goals, like what the goal should be for that role, and then what each role can do to meet that goal. So you can bring this, or you can, like I said, adapt it for how your practice works. We all know no two practices function alike. And then, most importantly, we really want to get feedback from them. Get the staff involved. They want to feel ownership and involvement in that, and that'll really help build the foundation for the change that's to come. It'll also get you new ideas. Somebody might say, I get this question all the time, and that might help inform how you're going to have the conversation, or a good place to address that with a patient. So you'll get new ideas, and it'll definitely help inform your training plan. So now that you've assessed everything, thanks, Karen. You're ready to go ahead and train. And I can't express enough how important it is to have dedicated training. The best kind of training is the type that happens, so just make sure it does. Pick a time that works for you, lunchtime, if you have a monthly staff meeting, a weekly staff meeting. Pick how it works for you, if you want to do a train the trainer with your champions, or you just want to have the full staff together. But the most important thing is make sure that dedicated training actually happens. We do have some materials at the bottom of the training. ACP actually has a great care conversation guide, a high-value care conversation guide, that'll give you some scripting for starting conversations. So that's a great piece to bring to training. And then Cost of Care is an organization that actually has modules with videos that show you how to have a cost of care conversation, and those can actually earn you CMEs. So definitely take a look at those. It's something your trainer can prepare for, or you can show to the staff during training as well. Other videos that are available and other courses that are available from ACP actually are related skills. So take a look and assess those other skills. They are actually a great foundation to having this conversation. So you might want to hone those skills, or take a look at improving them if you feel you need them. Shared decision-making, empathetic communication, change management, they're all really important, and ACP has modules for them, and some of them have CMEs available as well. So definitely a benefit to everybody. With training, also make sure that the full staff is involved. We want everybody to be on the same page. Just like we talked about with engaging, reinforce what their role is. So again, we have that workflow there. Bring the workflow that was informed by your feedback from all the stakeholders in the practice, so that they really understand, here's the goal for you, here's what we need you to do, but here's how it fits into the whole workflow, so that they really understand who they're supporting and who's supporting them. And then also be sure to define the conversation. Everybody has a different definition of what this is. NYACP actually has a definition for our early adopter incentive program, so that's available for you to use as well. You can take a look at it and adapted if needed, but it's really important to make sure that everybody is working towards the same definition of the conversation. Then another thing I would recommend is actually measuring after you train. So be prepared to gather information for quality improvement. It can be really simple, like how often is the conversation occurring or who's having the conversation. It doesn't have to be really crazy in depth, but it really helps inform, are you meeting your goals that you set out to meet? And it also identifies training needs, retraining needs. And retraining is really important. It is just as important as training. It's an opportunity for feedback. You'll figure out what's going well. Staff will often share new ideas. Hey, I had this challenge, so I tweaked it a little bit. And that way you can get everybody back on the same page. You can also identify any challenges or barriers that we might need to overcome. And then also consider new staff in the training. They need to know, and it's actually a perfect time for retraining. It gets everybody back on the same page at the same time that it's informing somebody new. So it's a great time to train and retrain everybody together. Then once you've done your training, of course, the next logical step is execute it. Put it into practice in your workflow. Really, the basis of this, make sure it's a team-based approach. We don't, again, want the burden or need the burden to fall on one person. It can be something small that's reinforced at every touch point with the patient. So it's simple, effective steps that everybody can share in and everybody can work towards a common goal. To help do that, also make things routine. So the easier it is to incorporate, the easier it is to sustain. We don't want a side workflow on the side that people have to, oh yeah, I have to remember to do this. No, we want to make it simple and routine, something that you do with everybody. It'll also make sure that the patients, or ensure I should say, that the patients are comfortable with it. Hey, they're already asking us these questions. Must be I can ask them too, or we can talk about it. It's okay. Some examples are universal screening. So financial screening questions, it can be a great flag to say, hey, this patient is probably going to need some conversation or some information or education on this subject. So you can do that at intake, or you can choose to have somebody who's rooming the patient do it, or the physician. But there's different places you can put it, but you can put it into the workflow to make it routine. And also build it into the care plan. We often in a care plan are looking at, barriers to care, and those barriers can include costs and even secondary costs. So consider building it in so you're always asking that. We do have examples of financial screening questions for you. I'll just open it up so you can get a quick peek at them here. But there's different ones related to specifically financial hardship. We do recommend that you put social determinants of health, like something for the social determinants of health in there as well. And then there's cost of care and cost of medications as well. So these come right out of literature, and you can see the references. So you can use some of these on your forms. You might already have them. Actually, a lot of people have told me that they already have them and may not have used them. So take a look at what you've already got. You'll be surprised. And then the other thing that you can do to make it routine, ACP has a great patient-centered referral discussion guide on this. I'm just going to show this to you really quickly. It is more than just cost information, but if you look at the last bullet point here on the first page, it says make sure the patient is involved in the process of choosing the appropriate referred to clinician. And you can build your list by looking at these tools and looking at quality, or looking at the cost ranges that'll suit your patient's needs. You can refer them to these tools and say, hey, if you're not sure of the right place to go, let me give you some tools that'll help you make that decision. So it's not 100% focused around cost, but there's places where you can put the cost in here and make that a routine discussion or routine information that's given at the time of every referral. And then also put it into your technology. We've already talked about it before, but some ideas. Those high-cost services that you order, or the services that you looked at, if there are high-cost ones that you order, put them in your decision support and your EHR. That way when you order it, you don't have to be thinking about, wait, what was the cost of this? You have the ranges right there. It'll help inform your conversations with your patients and decision making. For your patient portal, if you happen to have messaging in your patient portal and you are able to put in different subjects, put one in for the cost of care. When the patient sees that, they're going to know, hey, this is a question that they want me to ask and that I can ask, and that helps welcome the conversation without even involving you in a touch point or any of your staff at a patient touch point. So it's just another way to let them know that it's okay. And then also your website, consider putting links on. We talked about links earlier in the EHR. Think about putting links to all these resources for the patients on websites as well. That way, on your website, that way they can gather that information once they leave as well. So once you've incorporated this and you've gotten your workflow down, you can really start to encourage and empower more patients to talk with you about costs. Some are going to be easy right off the bat, and then others you might have to bring it out in. So you definitely want to start advertising that you're okay having the conversation, that you welcome it. And you can do this by putting posters in the waiting rooms or exam rooms. You can even have the front desk hand out wallet cards at check-in. Two resources for this, are the Choosing Wisely poster and the card. They both come from the same place, but it's two different resources. So Choosing Wisely, in that campaign, one of their 5 questions is actually how much will this cost? So having that there already encourages them asking the questions. You can take these posters, they're out there for use, or you can use them for ideas for posters or wallet cards for your own patients as well. I'll just go ahead and show you the poster really quick so you can get an idea of what it looks like. But just a simple poster, and you'll see question number 5 is how much does it cost? So we'll go ahead and close that. Then we want to make sure when we're actually in the visit with the patient that we're personalizing it and optimizing their care plans. So you can provide them options with price ranges. And again, it doesn't have to be exact prices. One idea is, I know somebody used low back pain, and it was for an statewide initiative in another state that they were already trying to work on. So they thought, hey, let's implement this cost of care conversation along with people coming in with low back pain. So they actually had a card for that had the different treatment options in different price ranges, and I liked it. It was very simple. The least expensive, or most cost-effective, I should say, was a single dollar sign, and then the next one up, which would be like the MRI, would be $2 signs, and then surgery would be $3 signs. So they had those to visually show the patient and help them make decisions on that. So just some ideas for providing options with price ranges. And then also consider their secondary costs. I mentioned them before, but in the care plan, when they have barriers to care, think about the cost not just of what you're ordering or the next lab, but also for follow-up visits or for a series of labs or procedures. If they have problems getting transportation or childcare or concerned about missing work, those are questions that you can fit in there and adjust. We're all used to adjusting to generic medications or changing dosage to help with medication costs. Think about, okay, can we change the timing of the visits? I mean, even the frequency or even the timing. Hey, let's get this done before their deductible rolls over for the new year, so they're not concerned about that cost because they've already met it for this year. So think about those things within the care plan. And then you can also help empower patients by improving their health literacy. So many people out there, they're having high deductible plans. They're not really sure what a deductible means, or they're not sure the difference between a copay and a coinsurance. Just giving them information that has those definitions will help them. It'll help them with navigation, knowing how to find out what's in or out of network, and even what that means to them. Why it's important to go talk to their insurance about it. So giving them this information will really help them be their own advocate. Choosing Wisely has patient information. Not only do they have information on, the basics, but they have information about different conditions, so that actually talk about, cost and are involving cost in there. So that's a really good place for them to go. There's also resources for you, as physicians and your staff. So Choosing Wisely is a great place to go for both. And then one of our online tools, which I'll get to in just a minute, Fair Health. Go ahead, we'll open that just to look at really quickly. But Fair Health actually has guidance. You'll see they have a whole insurance basics to get to. So not only do they allow people to search for prices, but they also have resources to help educate patients as well, helps them navigate a confusing system. So these are really great resources to hand out to your patients to educate them. And then educating them, like I said, is going to help them be their own advocate. And you can also reinforce that by giving them the tools that they need to take and go to the next facility or go to the specialist or even talk to their insurance. So, they may know, hey, I need to go check with my insurance, but often they'll call up and they'll not have the information they need that the person at the help desk is asking for. So consider, hey, can I give them a CPT code for this? Is it something I know, or is it something that I could have in my files for this that I can give them? Of course, most often we do give them the ICD-10 code, but also consider the NPI. If they want to check in or out of network, that way there's no question. If you have a list already of common places you refer to, have their NPI number ready. That way you can just hand it to the patient and they can absolutely know for sure that person or that facility is in network for them. And then another thing to consider for helping them be their own advocate is provide them a summary of next steps. So, we often give them, a summary or an overview when they leave, especially if you're doing a care plan, but consider multiple steps instead of just the next step. So for instance, if somebody had an abnormal mammogram, that we'd want to send them for an MRI, instead of just saying, okay, the next step is an MRI, also talk about then, the breast surgeon and, biopsy, so they can look up, if they need to, look up the best facilities for them and look up price ranges for that, for those to either inform their decision or just to be prepared. A lot of this is really preparing them, empowering them so that they can take this education not only in visits with you, but to other visits as well and throughout the system. So it's really empowering them to be their own advocate. So that was a lot of information, a lot of tools and strategies, but I definitely want to make sure that I still share a few more with you, and I want to give you a tidbit of the online tools that are available. You guys, thank you for everybody who participated in our member survey, and I saw there that it's definitely something that you want, so we have it for you. There is a full list of the tools that we vetted on our website. There's links to it here, and then the next slide I'll just show you where you can find it on our website. But there's also a quick reference guide that we've put together as well, and I recommend you look through that quick reference guide. Some of this is a little snapshot of it, but it tells you what cost information is shared for each tool, what type of quality information, if any, is shared for each tool. We all know there's no one definition for quality right now, so what they share. And then also what each tool is best for. And this will really give you a great starting place to search for those tools instead of kind of just going through the list. It'll give you a jumping off point for what you think would be great for you or how you want to use it. So just a couple that I'll go through here. Amino and Fair Health at the top. They're really good for anybody to use to search, patients or physicians or staff. They'll give an idea of different prices for different locations. Fair Health does one for in and out of network comparison. So it's a great way to prepare for expenses. What can they expect? And also give them insight into price variations. That's one thing that a lot of patients are not aware of, that there are vast price variations between facilities for the same service. So it'll give them insight into that. Healthcare Blue Book is one that I really recommend for physicians. you guys get more information when you log in than the patient would as a consumer on the front end. So you need an NPI to sign up. I would recommend going and signing up on that page, but you'll be able to look at prices that include Medicare and commercial costs for service or for facilities and for specialists and other physicians in your area. So you see more information and more facilities and more doctors than the patient does in the search that doesn't include the login. So I think this is best for you. You can definitely use it to understand what patients should reasonably expect to pay, and you can also use it to inform your referral list. A lot of times they'll have like a little icon like, oh, this is a high price place versus, this is a relatively average price place. So take a look at that. And then, of course, New York Doctor Profile doesn't have cost information on it, but it does have quality information on it, education information, any legal action, things like that. You can help. It can help build a referral list if you aren't familiar with that individual. And you can also add your own information to your own profile, let you add information about yourself. So I definitely encourage anytime you can do that, go out there and do that as well. So again, these are all on our website. I know we covered a lot of different resources and all the different steps. So here's a summary. I'm not going to read through all of them, but they all have links to, each step has links to all of the resources that were discussed for each step. And then at the bottom, there's a link to our page, but also a screenshot. So, it looks familiar when you get to that, how to get to that page. And then last but not least, we want to give you information on the next webinar coming up. So that's scheduled for September 6th. It's actually with Avalere Health, a DC-based advisory health services firm, and they're going to be discussing learnings from 8 Robert Wood Johnson Foundation-funded projects. Those projects were focused on developing messaging and workflows to support cost of care and quality of care conversations. Definitely welcome clinical and non-clinical registrants, anyone who's going to find this information meaningful. So, today I wanted to give you a starting point. You can take it and run with it and know what you need and use those materials. But this one will actually we'll go more in depth on specific topics like key areas for improving the conversation and how to introduce the cost of care conversations as a normal part of the routine clinical encounter. So you'll have, considerations for your workflows and things like that. So with that being said, I just wanted to open this up. That was a lot of information. Hopefully you jotted some questions down, but I just wanted to open it up to any questions now.
Thanks, Amanda. Yes, I'd like to remind everybody we now have about 15 minutes. If you would like to ask Amanda a question, please type so in the right-hand side of your screen in the dialog box. We do have a couple questions in the queue, and I will begin. Are you talking about quality and cost of my services, or those I refer out to?
You can use it for both. You can look at what your costs are and promote, hey, I do a great job. Or you can actually look at the ones for referring out and help build your list or help be prepared to give your patients options. Maybe sometimes you need to stay in your specific network, but if the patient really can't afford that and it's a risk for them, you can have other options for them as well.
Great. The next question is, I don't want to be in the position of looking at other physician prices. Worry of antitrust. Can you give guidance as to the best way to encourage or counsel patients to look for themselves?
Yeah, I think the best way is really just to let them know that there are options out there. So, you give them options, or you talk about the risks and benefits already. You need to add costs in there as well, but provide them options and, help them just prepare for the cost. So it's not always just saying Dr. A charges this and Dr. B charges this. Sometimes it's just letting them know, hey, you've got a high deductible. This is going to be in the, $800 to $1,000 range for you. So, towards your deductible. So sometimes it's just preparing them for and helping them plan.
So at this point, we do not have any more questions in the queue. I just want to remind everybody once again, this webinar has been recorded and will be on the chapter website at www.nyacp.org. It'll be on the practice management page and also on the recorded webinar page. Later on today or tomorrow, you'll be receiving an email from Amanda with a short 3-question survey and with the handouts with all the links and tools that she talked about in today's webinar, and any other valuable information that you learned today. So any last words, Amanda?
No, I just want to say thank you, everybody, for attending. I'm so glad that you're interested in this and you find it important. Again, please feedback. Definitely take that really short survey, and I hope this got ideas churning and will help you take the first step in implementing the conversation. And keep your eye out on YCIA and come back for this webinar to learn even more.
Great. Thank you, everybody. This concludes the webinar. Have a great day.